Okay, so let's take a look at chapter 6, which is skeletal system, objective 7. And we're going to take a look at calcium homeostasis. And I'm going to tell y'all that you're going to need to know this still for AP2. So this is one of those objectives where we're going to talk about it, but I promise you're going to talk about it again in anatomy 2, day 1 kind of stuff. So put this in your long-term memory. It will help you with the endocrine system when you get to AP2. So, calcium, most abundant mineral in bone. Yes, there's phosphorus in there, but again, calcium is the most abundant. What is the job of calcium in bone? Well, it helps make bone. It helps make that bone matrix, that bone mineralization. Of course, your teeth are important. Calcium is needed for tooth health as well. Now, calcium is important in your muscle contractions. So, of course, it's going to be involved in the cardiac muscle cells, in the regulation of heart rate. I'm skipping down to the next one, contraction of all muscle, whether it be skeletal, smooth, or cardiac. It's also involved in blood coagulation, which is blood clotting. So, yes, you need a bunch of things actually for your blood to clot. Platelets, there's a whole cascade of events, a series of steps that have to occur in order for blood to clot. And if you're missing one of those components, blood won't clot. So it's a pretty involved process. It's just not a one process thing, one step thing. It's like 10 steps. Calcium is one of those steps. So it is necessary to help blood clotting, blood coagulation. And as we're going to learn in chapter 12, when we get to the nervous system, calcium is also needed in order to send electrical signals from one point to another point. Calcium is needed to help regulate nerve impulses. Now, on this slide here, you don't have to know the numbers. Okay, so I'm not really interested in the normal blood calcium levels. You have to know that when you get to the nursing program, but I did want to go ahead and put it on there. You need about 10 milligrams of calcium for every 1 deciliter of blood. So just to kind of give you an idea on that, again, you don't need to know it for the test. What you need to know for the test is this definition right here. Hypercalcemia. So you should recognize that hyper means too much. The middle part, the root, CALC, is referring to calcium. And then emia, anytime you see emia in a word, that's referring to the blood. So this literally translates to too much calcium in the blood. You don't have to know the effects of somebody who has too much calcium in the blood, hypercalcemia, but you can see some of the issues there if you were curious. Now, again, the only thing on this slide you need to know is hypocalcemia in its definition. This is hypo means too little or below. So you're looking at too little calcium in the blood, emia. And you can see there that some of the problems with too little calcium in the blood. Again, I'm not going to ask you to know those. It's just kind of interesting, but it definitely could. I mean, this is serious. I mean, it could lead to coma and death. Okay, calcium homeostasis. Calcium is needed for, we mentioned the nervous system. It's needed for the skeletal system. It's needed for the circulatory system. It's needed for the muscle system. So it's needed for a lot of systems. So it's very important to have certain levels of calcium in the blood, which means there are many systems helping maintain the levels of calcium in the blood. So it's got 3 systems that we're going to kind of talk about that help maintain the amount of calcium that's needed for the blood. The skeletal system helps maintain it. Of course, calcium is stored in the bone until it's needed. And then when the circulatory system needs the calcium, calcium is released into the blood by osteoclasts. Remember, osteoclasts break bone down. Well, what does it do with the calcium? Well, it puts it in the blood. If your blood has too much calcium, the calcium will be removed by osteoblasts, meaning the osteoblasts are going to take the calcium and create bone with it. So that's one system. The endocrine system is another one. We're going to learn this here in just a second. Parathyroid hormone, which is secreted from your parathyroid gland, is going to be involved in getting the calcium into the blood the way it's supposed to. And then also your kidney is going to be involved in getting that active form of vitamin D, so that way the calcium can leave the digestive system and go into the circulatory system, again, if the calcium levels are too low. So you've got the endocrine system, the digestive system, you've got several systems involved in maintaining homeostasis regarding calcium levels. So calcium homeostasis, keep in mind, bones act as a storage site for calcium. So when blood calcium gets too high, the body deposits calcium in the bones. When blood calcium gets too low, the calcium goes from the bone and goes into the blood. So again, keep in mind your bones are storage for calcium based on the needs of the circulatory system. Really nice summary slide. What we're going to do is we're going to look at one side first. So low blood calcium, we're going to look at this side first. And low blood calcium is the problem. Keep in mind negative feedback, right? So think back to negative feedback, which helps maintain homeostasis. That's exactly what we're talking about here. So your blood calcium is too low. That's the problem. How is your body going to fix it? Your sensory receptors, okay, you got your sensor, which happens to be, in this case, your parathyroid gland, is going to pick up that, hey, blood, as the blood is passing through the parathyroid gland, it's going to pick up and say, oh, blood calcium's too low. So the parathyroid gland, also the control center, is going to secrete parathyroid hormone. It says blood calcium's too low. Let me secrete some parathyroid hormone. What does parathyroid hormone do? So what is the effector? The effector is the osteoclast. I'm going to put an E there for effector. The presence of parathyroid hormone is going to tell the osteoclast, hey, you need to get busy there. Well, what do osteoclasts do? They break bone down, and that leftover calcium from the destruction of bone is going to go into the blood. That's going to cause blood calcium levels to rise, and we're all back to normal again. So you've got your sensor, you've got your control center, and you've got your effector, which is in this case the osteoclasts. Okay, so now let's take a look at what if the problem is over here? What if the problem is, oh, blood calcium is too high? So that's the stimulus, that's the problem. So what is your sensor? Your sensor is the thyroid gland in this case. Thyroid gland, as blood's passing through it, the thyroid gland is going to pick up that blood calcium is too high. It also happens to be your control center. So it's going to secrete a hormone called calcitonin. Be careful, that's not calcitrol, that's calcitonin. Thyroid gland is going to secrete calcitonin, and the effector is going to be osteoblasts. Now, what do osteoblasts do? They build bone matrix. So they're going to take that calcium and build bone out of it. Well, when they pull the calcium from the blood to build the bone, you're removing calcium from the blood, and the blood calcium levels fall back to normal again. So make sure you understand what low blood calcium does and how it is fixed, and then what high blood calcium does and how it is fixed. So again, if blood calcium is too low, kind of reviewing a little bit more in depth there, the parathyroid gland has calcium binding receptors, and when these receptors are not binding calcium, because there's no calcium in the blood, the parathyroid gland secretes parathyroid hormone. Now, parathyroid hormone does a couple of things. Yes, it stimulates osteoclast activity. Osteoclasts break bone apart, and that's going to put the calcium back in the blood. Now, parathyroid hormone also stimulates the synthesis of vitamin D. So it is going to tell the kidney, hey, you remember that vitamin D that the skin made? Take it now and make it into calcitrol. So that way it's available for the small intestine to pull the calcium out and put it in the bloodstream. So again, parathyroid hormone also stimulates calcium to be absorbed by the kidneys from the urine. So your kidneys, their job is to take the blood and clean it out and send the waste out in the form of urine. Well, some of that waste could be calcium. So what the parathyroid hormone does is when the calcium sees the parathyroid hormone, it says, oh, wait a minute, you want me to keep the calcium? Don't send it out in the urine. Keep it. So your kidneys are kind of doing two things there. They're converting vitamin D to calcitrol, which is going to go to the digestive system and let the body know, hey, don't get rid of the calcium in the feces. Keep it in the bloodstream. Let's get it in the bloodstream. And then the kidneys are going to say, oh, okay, and we don't want the calcium going out in the urine. We're going to keep it. So parathyroid hormone works on all of these. Conversely, if blood calcium is too high, the thyroid gland is going to get involved, and it's going to release a hormone called calcitonin. Now, calcitonin is going to prevent osteoclast activity, and stimulate osteoblast activity. So osteoclasts, remember, break bone down. Well, where's the excess calcium going to go? Into the blood. So we're going to prevent the osteoclasts from doing that. But it's also going to stimulate osteoblasts to start taking the calcium out of the blood and making bone with it. So we're going to create bone matrix is what we're going to do. So question number 20. When a person is experiencing hypocalcemia, the blank gland will secrete what? Hypocalcemia is low blood calcium. Parathyroid gland is going to secrete parathyroid hormone in that instance. Okay, that was all for objective 7.